Welcome to the GTA Advisors Podcast. We interview Greater Toronto Area business owners, entrepreneurs, and thought leaders. Our goal is to bring Greater Toronto Area residents the best advice from our community's brightest minds. Now, here's your host, author, entrepreneur, and real estate innovator, Robert Caruso.
Welcome, everyone, to another episode of the GTA Advisors Podcast. Robert Caruso here. I'm here with Dr. David Ellis. He's a facial plastic surgeon in Toronto, specializing in the head and neck. Basically, your business is called Art of Facial Surgery. Welcome, Dr. David Ellis, to the show.
I'm glad to be here.
That's excellent. So maybe before we start talking about your clinic and the kind of procedures you perform, maybe tell us a little bit about your backstory, maybe where you grew up. What did you enjoy doing when you were younger, and what made you then get into the actual plastic surgery field?
So what happened? Growing up, I one of the few people that were born in Toronto, and I grew up in Toronto. And during my training doing head and neck surgery, we did a lot of cancer surgery. Chop out throats for cancer, jaws, tongues, and I didn't find that very appealing or nice. I wanted to do something more, shall we say, aesthetic. It's like the gynecologist who delivers baby and everyone's happy with the baby, but when the female gets older, they get into problems with cancer and whatnot. So the way my thought processes went is that I liked more of the pleasant field or the aesthetic field. And after my fellowship training, I took specialized training in facial plastic surgery in the United States, because there was none in Canada at that time. And I honed my skills as a facial plastic surgeon doing facelift, nose jobs, eyelid surgery. And now, of course, we have a great growth in our field over the last decade in terms of injectable fillers and Botox, which when I first started was just sort of coming in to the field.
Mm-hmm. Yeah, we could talk a little bit more about exactly your procedures. So I'm assuming that right out of school, you got into becoming a plastic surgeon.
I had to go through medical school first.
Yeah, of course.
Learn all the basics in the physiology of the body, but I felt that the anatomy of the head and neck versus was very complex, and I think in 3 dimensions. So there aren't so many layers. There's sub-layers in doing surgery of the head and neck, and that's what really interested me. And then going through that specialized program for 4 years after internship, I said, I really didn't like the head and neck cancers results back then. They're much better now, I must say, and the reconstruction is much better. But then I leaned towards doing more aesthetic surgery of the head and neck.
Mm-hmm. So everybody has challenges in business. I can attest to that myself.
Sure, yeah.
What's been your biggest challenge?
I think my biggest challenge was assessing my patients that come to me to make sure they're the appropriate choice to have a procedure, whether it's a laser skin resurfacing, whether it's Botox. They have to fully understand what I'm doing. So it's not like, oh, this is pretty, why don't you buy it? It's really doing an educational sale and showing them what are the good points and the bad points of what I'm doing, because not everything is 100% perfect. I tell all my patients that we're going for improvement not perfection.
There is no such thing as, well, we're all perfect. That's the bottom line. But we can improve. We can all have.
That's right. Yeah.
So that's what basically you're doing, is you're trying to improve somebody's face, right?
That is correct. Yeah.
Let's go back in time a little bit. Before you actually became a plastic surgeon, knowing what you know now, is there anything you would have told your former self to do differently?
I don't think so, because I think part of my, shall we say, brain is obviously, I have some brains, I'm not dumb, but I think in 3 dimensions. So if you go back, maybe I could be a sculptor, maybe I could be an architect, but architectural never sort of crossed my mind. When I was traveling in Europe, backpacking, I saw all these cathedrals, and I said, well, they're fancy and whatnot, but I couldn't see how to even build them or conceive of them to make them structurally right. That sort of wasn't in my brain power at then. Perhaps in retrospect, I might do that. I don't know.
That's interesting. That's very interesting. So, as far as though your business is concerned and what you've done in your practice, you would have. How about that? Would you have done anything differently with that?
No, I think in my field, and I think in a lot of surgical fields, the technology and the equipment and the devices that are brought to us have become very, very useful. Phew, a tongue twister for me. But anyways, we didn't have lasers, and we have the use of lasers. So they weren't invented way back then. And so our field has really grown exponentially in terms of I have to keep learning. So I'll go to a meeting in the United States, and I may lecture about one problem, but I'll sit around and hear about something else. Hey, that might be a good technique to just try to make my results a little bit better for me and my patients.
Excellent. Maybe now's a good time to talk a little bit about your practice and what exactly you do. So obviously you're a plastic surgeon. You help improve people's appearance. What else do you do at the clinic?
Well, basically, that's it. People come in with a specific problem. Some surgical and not surgical. A good example, for instance, I had a patient just the other day that is on a diet and going to one of the diet places, and she was pretty happy with the weight that she lost around her waist, but she didn't like the shrinkage of her cheeks. And that's a relatively easy problem to correct, because I just inject a little bit of filler in there to restore the convexity of the cheek. And, that is very rewarding and quite simple to do, and patients are happy. And the injectable filler that I would use in the cheeks would last a good 18 months before they need a refill. So the injectable fillers now tend to last a long time. Whereas in the early days when collagen came out, they were lucky to get 3 months use, and they would keep coming back. So the background in the technology of developing these injectable fillers have been tremendous. And of course, it's benefited all my patients.
Mm-hmm. And I was going to ask you how long they last, and 18 months is quite a long time.
But that's if we put it in the cheek here. If we put it in here where there's lots of movement, you may get a year, up to a year, before it needs to be refilled.
I see. Let me ask you, I mean, I've heard it was safe, totally safe to do this, but I'm sure people have questions. Is there any kind of risks involved?
Oh, yes. There's risk. Don't forget, I'm putting a tiny little needle into the patient, and For instance, we always prep the face with chlorhexidine rather than alcohol, which is a much better antiseptic, and you can get bruising. And some of the permanent fillers that we have used in the past have actually migrated. So there are a group of patients that wanted a permanent filler. That was very good. However, over the years, we find it migrate. So we're seeing some problems.
Sorry to interrupt you, but what does that mean by migrating and permanent?
Well, moving. So may put it in the cheek, and it may end up as a jowl 15 years later, 10 years later.
Interesting.
So those products that were passed at Health Canada as being safe and not migrating or moving, they have now been shown to move. And so there are a lot of patients who didn't want regular injections that wanted something, quote, permanent, and now they're having some problems because of migration.
Interesting. So if that were to happen, I'm assuming it can be removed, right? I mean, if it moves around, it's obviously...
Oh, yeah, you could actually, there's a simple way of doing it without scarring. But I've even, in some of the old patients that have had it come in, they have a facelift, and I try to vacuum it all out. So it can be dealt with, but usually not with surgery. Usually putting a little freezing in if they have a jowl there, and squeezing it out like toothpaste.
Now, okay, so obviously the fillers that's happening these days is obviously a lot more cost effective. Yes, it doesn't last as long as an actual facelift, right? Because an actual facelift is something you're moving the skin, correct? And,
correct,
you're actually cutting and stretching it back or whatever, right?
But it's interesting, facelifts don't last forever, because as I put it in the last little stitch, they're beginning to age, or they're continuing to age. So the only, quote, permanent thing is a nose job. And if someone knocks out their front teeth here, the nose will do this, collapse. So not even rhinoplasties are permanent if there's trouble with the dentation later on in life. So there's always little nuances that patients should be well aware of. But basically, a nose job is a permanent procedure. And whereas anti-aging surgery, like a forehead lift, a facelift, a mid-facelift, is temporary, but it could last 10 years before the clock goes back to what they were.
Well, I mean, we are aging every second, right? So nothing lasts forever.
We don't like to say every second, but you're right. And it's interesting, we don't age at a steady rate. Like, up until the age of 50, females don't really age. And then once they get around menopause, they start to age, especially if they're estrogen delinquent. And some of my patients do take estrogen. Some take natural estrogens and some take estrogen, because it slows the sagging process down.
Oh, so that's interesting to know. So is this something that's, I'm sure it's well known in the medical field, but is this something that the average person should know about? Or?
No, probably not, but that's why they have to have consultations with people like myself. Like, I look at myself as an anti-aging surgeon, whereas there's some people that do anti-aging medicine. And they do all the hormone scans and blood tests, and they do the adjustment to try to slow the aging process.
So you're more than just, come in, let's, cut you open and, stretch the face or add a filler. You will give some sort of like advice.
Oh, sure. Oh, yes.
That's great. That's good to hear.
Yeah.
I mean, that's
especially in the 40-year-olds that are beginning to feel the aging process coming along. They want to delay it. And that's an interesting thing about Botox. Botox we're doing earlier and earlier now. We're doing people in their late 20s because if they're habitual frowners, what'll happen, they'll get the famous number 11. And if we put Botox in their frown lines, then what happens, they don't get the famous number 11. Mm-hmm. So they become wrinkle-free or they don't get the wrinkle.
Yeah, absolutely. Absolutely. Mm-hmm. Is there any, I'm sure you have other associates that work with you as well. Are they doing the same procedures? Or are they doing other procedures? Or?
Oh, no. Everyone does a little bit of everything. My colleagues in Toronto. And I tell patients that, you got to really like the personality of the doctor and the feeling of the doctor. And I think one of the cruxes, if they're going to have surgery, will they be happy if they have to if the surgeon gets a complication, whether small or little, whether they would be comfortable in having that surgeon treat them. And I would hope that most patients would say yes before they undergo the surgery.
Mm-hmm. I want to ask you a question about a time when you made a difference. Like, I'm sure you've made people look much younger, but is there any specific sort of like procedure or time that you worked on somebody and it really made a huge difference and you were
yes.
Wow, that's
yeah. I had about 10 years ago now, I had a patient come in who got her dad's nose, a big, huge nose, and she came in with her mother, and she was really very quiet, and she wasn't nicely dressed. She was all right, if you know what I mean. And her hair was all down, and she maybe needed it washed and whatnot. So I explained to them all about nose jobs and rhinoplasties and how we do it, and the recovery and the complications and everything. And then about 2 months after the surgery, when I was checking her to make sure she was healing the normal way, she had completely personality change. She had nice hair. She had it all combed back and brushed and curled. She was wearing a nice little blouse rather than a sweater, and it has nothing to do with the time of year. And she was saying, she was having lots of fun at school now. And so it was really what I call psychosurgery. I really took that oppression over her head, her big father's nose, and gave her a nice looking nose that she felt comfortable in, and her personality just bloomed.
That's incredible. It's good to hear. Let's imagine. Okay, well, instead of you asking it this, let's just say, what are the reasons why people should use your clinic or your services?
Well, basically, I offer a great variety. I just don't do one thing. That there are a lot of clinics that just do fillers. They don't think that maybe that could be surgery. So I could offer a complete package with lots of options and lots of choices. That sometimes may be more complex, but to me it's a lot safer. Like I had a patient the other day said, I said, well, you got bags under your eyes. Why don't we do some surgery? She said, I don't want surgery. And I said, well, then there's a way that I could do it with fillers and to camouflage the bags so to make her look quite nice. And she was very, very pleased with the result. So I could offer a little bit of everything and a lot of everything to give patients choices. So it's just not one choice. There's many choices, and I think that's a good reason to come and at least have a consultation with me. If you don't like it, well, you can go elsewhere. Mm-hmm. So I'm not that guarded with my practice. I like to offer patients an honest choice.
And you have the one location, correct?
That is correct.
And sorry, can you give us your location while you're at it?
Yeah, I'm at Bayview and Shepherd. I'm in the northwest corner.
Okay, good. I'll have all the address and other links to your website and everything on the show notes. Is there any book that you've read that's helped mold you?
Not really, because in one medical book, I might find something that's really good, and another book it may be good. So basically, in my continuing medical education, not only do I lecture internationally, I've lectured basically all over the world, but I always pick up a little tidbit about, maybe I should try this. And then if I don't quite fully understand it, I'll go up and ask the surgeon, what about this and what about that? So my learning isn't necessarily through reading, but going to meetings, both Canadian. I just lectured last Saturday in Toronto at a Canadian Academy of Facial Plastic and Reconstructive Surgery, and I talked about unusual uses of fillers. But there were some talks on nose jobs, there was talks on facelifts and blepharoplasties, eyelid surgery, that is, and it was very, very good. And so that's how we all learn. We share knowledge and share results.
That's amazing. I really appreciate you coming on to the show today and giving us some insight as to insight into your business and who you are, and to give people a sort of like a back end look at the doctor behind the facial surgery. So again, thank you for coming on the show. Is there anything you want to add, Dr. Ellis?
No, if people are really inquisitive, they can always give me a phone call. I'm here in Toronto, and my number is 416-229-1050. And all you can think of is chum, 1050. So that's a way of reminding. And thank you very much for interviewing me. I hope it was helpful to you and your audience.
Absolutely, it will be. And we'll have all the information on the show notes so people get in touch with you. And again, I really appreciate you coming on the show.
Okay, great.